feeling hollow, my bones like brittle glass. Life's heavy burdens follow, but I won't let them pass. The weak can find their fire in every aching step, climbing a little higher in the void where dreams are kept. I'm not a shadow anymore, I'm finding muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow. My hands are shaking steady, sweat drips like melting ice. I've never felt so heavy, but I don't need to think twice. Fear feeds on fragile whispers, but I'll scream till it's worn out. Every scar turns it into blisters, I keep fighting, shed the doubt. I'm not a shadow anymore, I'm fighting muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow.
Ever find it kind of crazy how fast you lose fitness when you're stuck recovering from an injury or laid up sick?
Yeah, it's like our bodies have this use it or lose it setting, right?
Exactly. And apparently there's actually a name for this whole process, deconditioning syndrome. So today we're going to do a deep dive into what happens when our bodies are forced to take a break from being active.
You got it. And it's important to remember deconditioning can happen to anyone. We tend to think about athletes, but it really affects anybody who has to decrease their mobility for whatever reason, illness, injury, after surgery, even just being bedridden for a while. It's surprisingly common.
It is kind of wild to think about all the things that change when we're not active. And I'm not even talking about the obvious stuff, like
Yeah.
losing muscle.
Right. It goes so much deeper than that. We're going to be looking at all kinds of surprising effects, from changes in bone density to mental health and even how our brains are impacted. It's fascinating stuff.
Okay, so let's start with something we can all relate to, that muscle loss. One of the sources talked about someone with a broken leg who lost a ton of muscle in their thigh within weeks. That seems so fast. What's going on there?
Well, basically, when you're not active, your body kind of goes into power-saving mode. And muscle's expensive to maintain energy-wise. So if you're not using it, the body decides to use those resources somewhere else.
So, like, it's more efficient to break it down for fuel than keep it around?
Pretty much, yeah. You get decreased protein synthesis, which is how we build muscle, and at the same time, increased protein breakdown. It's like your body's saying, look, muscle is a luxury we can't afford right now.
Wow, okay, so is all muscle lost equally?
Good question. It actually turns out the fastest loss happens in what we call type 2 muscle fibers. And those are the fibers responsible for power and quick movements, like if you're climbing stairs or, I don't know, carrying all the grocery bags in one trip.
That makes sense. It feels so much harder to get that strength back after you've been inactive.
It definitely does.
So another thing we saw in the research was about how deconditioning affects our cardiovascular and respiratory systems, our heart and lungs, basically. I remember reading this example about patients in the ICU who were struggling to even stand up without feeling super dizzy. Why does that happen?
So it all comes down to efficiency, or I guess in this case, inefficiency. Basically, when we're inactive, our heart kind of gets lazy. The amount of blood it pumps with each beat decreases, and our overall cardiac output goes down.
Okay, so our heart isn't working as hard, and that's affecting how our blood pressure is regulated.
Exactly. And it's not just the heart either. A lung capacity decreases too because we're not taking those nice deep breaths as often. And because of that, we're not clearing mucus from our lungs as well, which makes us more vulnerable to infections like pneumonia.
Wow, it really is a domino effect. One thing leads to another, and suddenly your whole body is struggling. And speaking of domino effects, let's talk about something that might not be as obvious, bone density loss. We usually think of that as something that happens as we get older, but you're saying inactivity plays a big role too.
Yeah, think of astronauts, right? When they're up in space, they actually experience pretty rapid bone loss because there's no gravity. So their bones aren't being loaded, they're not under stress. And stress is actually good for bones, believe it or not. Our bones are constantly remodeling themselves, breaking down old tissue and building new. But without the stress of weight-bearing activities, that balance gets thrown off and you end up with weaker, more fragile bones.
So it's not just about preventing falls later in life, it's about actively keeping our bones healthy throughout our lives.
100%, yeah. And this actually leads into a really interesting part of deconditioning, how it affects our mental and cognitive well-being.
I gotta admit, I was pretty surprised to learn that deconditioning wasn't just physical.
Yeah.
One of the sources linked it to a higher risk of things like depression and anxiety, especially for people recovering from surgery or illness. How does not being active impact our mental health?
Well, it creates this kind of vicious cycle. When you're not active, you often feel like you're losing control, independence, and that can lead to feeling really hopeless, really down, which are, classic symptoms of depression. But on top of that, you might start to get anxious about recovering, about whether you'll ever be able to do the things you used to do, about getting back to your normal life.
So you're dealing with the physical limitations, and then on top of that, your mental and emotional state is taking a hit too. And then there was this other connection we saw, the one to cognitive decline. What does that actually mean for people in their everyday lives?
Think of your brain like a muscle. You got to use it or you lose it, right? When we're not physically active, our brains aren't getting the stimulation they need, and that affects something called neuroplasticity. It's basically the brain's ability to change and adapt, rewire itself, make new connections. So when we're not active, we see problems with things like memory, decision making, focus, even just how quickly we process information. Everything slows down.
So it's not just about being physically healthy, it's about keeping our brains healthy and working well too.
Okay, so we've talked about a lot of negative stuff so far. What can we do to prevent this? Or at least make it less bad?
The good news is deconditioning is mostly preventable. And one of the most important things is early mobility.
So what does that look like?
It's all about getting people moving as soon as it's safe, even if they're still in the hospital. Simple things like ankle pumps if someone's bedridden just to get the blood flowing. Or maybe a nurse or therapist helps them gently move their joints through their full range of motion to prevent stiffness.
So even tiny movements can make a difference.
Absolutely, yeah. And then as you start to feel a bit stronger, you can build up to sitting up, then standing, then walking a little bit. It's all about listening to your body and pushing yourself a little bit at a time. It's all about taking those baby steps, and not getting discouraged if progress is slow. Yeah, totally. And I think that leads perfectly into something else we talked about, those guidelines from the American Heart Association, right? They recommend at least 150 minutes of moderate intensity exercise every week. But for someone who's been inactive, that can seem like an LT.
It can, yeah. But the thing is, you don't have to go from 0 to 60 right away. It's all about working your way up gradually.
So what would that look like? Like if you were working with someone, how would you approach that?
Well, first, I'd make sure they're cleared by their doctor, of course. But then we'd start small. Maybe just a 10-minute walk to begin with, and then each week we'd add a little bit more time or distance, depending on how they're feeling.
So like a walk before you can run kind of thing.
Exactly. And the key is consistency, not intensity, at least at the beginning. You want to build that habit first, and then as you get stronger and more comfortable, you can start to bump up the intensity.
What about activities besides walking? Are there other things people can do to get to that 150 minutes?
Oh, tons. Swimming, cycling, dancing, even gardening can count. Anything that gets your heart rate up and makes you breathe a little harder.
I like that. So it's not just about hitting the gym or running on a treadmill. It's about finding something you actually enjoy doing.
Exactly, because if you like it, you're way more likely to stick with it, right? And the other thing is, it doesn't have to be one big chunk of time. You can totally break it up throughout the day, like 10 minutes here, 15 minutes there. It all adds up.
I love that. Making it part of your daily life, not just another thing on your to-do list.
Yeah.
What are some other ways people can incorporate more activity into their daily routine?
Well, I always tell people to think about those little opportunities that pop up throughout the day. Like instead of taking the elevator, take the stairs. Or if you're stuck at a desk all day, stand up and walk around every hour or so.
So it's about those little changes, those little choices you make throughout the day.
Yeah, exactly. It's about being mindful and intentional, because it all adds up. Like take your lunch break outside and go for a walk. Or if you're watching TV, do some stretches or light exercises during commercials. There are so many ways to sneak in those extra bits of movement.
I love that. Turning those times when you're usually sitting around into chances to be active.
Right. It's a total mindset shift.
And another thing we talked about earlier that's super important is having a good support system.
Yeah.
Can you talk a bit more about how family, caregivers, and healthcare providers can help people stay active?
Oh, they're essential. Sometimes all it takes is having someone there to encourage you, to hold you accountable, someone to go on those walks with you or remind you to do your exercises.
Yeah, sometimes you just need that extra push, right? Like someone to remind you why you're doing it and to celebrate those little victories with you.
Exactly. We all need a cheerleader in our corner, don't we? And speaking of healthcare providers, we talked about how important it is to talk to them if you're worried about deconditioning. What can they do to help?
Well, they can definitely assess your individual needs, right? Like
Mm-hmm.
figure out what's going on and see if there are any underlying issues that need to be addressed.
Exactly. And they can help you come up with a plan to get you moving again safely and effectively. They can also connect you with resources and specialists like a home health physical therapist, which can be a game changer, especially for people who have trouble getting out and about.
Yes, let's talk about that. Home health physical therapy seems like such a great resource.
It is. It's like bringing the expertise right to your doorstep.
Can you walk us through what that might look like?
Sure. Basically, a physical therapist comes to your home and works with you one-on-one. They create a plan specifically for you based on your goals, limitations, all of that.
Sounds super personalized.
It is. They'll help you with things like strength training, balance exercises, pain management, whatever you need. And they can also look at your home environment and suggest ways to make it safer and easier to get around. Things like grab bars or ramps, or even just rearranging furniture. They can also help you find and use assistive devices if necessary, like walkers or canes.
So it's like having a personal trainer and a health coach all in one, but focused specifically on getting you back on your feet and functioning well in your home.
Exactly. And they're really committed to helping you reach your full potential, to be as independent as possible.
That's amazing. So I guess the main takeaway here is that while deconditioning is a real thing and it can have a big impact on our lives, it's not something we have to just accept. There are things we can do to prevent it and to bounce back if it does happen.
That's right. It's all about taking that first step and remembering that there's support out there. There are people who want to help you get back to feeling your best.
It really is inspiring to hear about people taking charge of their health like that.
Yeah.
We've covered a lot of ground today talking about the physical effects of deconditioning, the link to mental health, and some strategies to prevent it or recover from it. But I think one of the biggest takeaways for me is just how important it is to have that support system in place. It really can make all the difference in the world.
Oh, absolutely. I mean, think about it. When you're feeling down, when you're struggling to stay motivated, having someone there to cheer you on, to remind you why you're doing all of this, it can be huge.
It's easy to underestimate how powerful just a little bit of encouragement can be.
Right. And that's where family comes in, friends, caregivers, your healthcare providers. They can be your cheerleaders. They can help keep you on track and celebrate those small wins with you. And speaking of healthcare providers, we've talked a lot about home health physical therapy, especially for people who are having a hard time getting out to a clinic or a gym. I think it's such a cool service.
It is. I mean, not everyone can easily get to a traditional therapy setting. So to have that expertise come right to your door, it's going to be a game changer for a lot of people.
It really is. It's like personalized care in the comfort of your own home.
So for someone who's never experienced this type of therapy, can you describe what a typical session might look like?
Okay, so picture this. The physical therapist shows up at your house. They've already looked over your medical history, and they know what your goals are, what your limitations are. They've come up with a plan just for you.
So it's super tailored to each individual person.
Totally. And then, depending on your needs, they might take you through some exercises to improve your strength and flexibility. They might teach you some techniques to improve your balance. It's all about getting you back to doing the things you need and want to do.
And all of this is happening in your own space, whether that's your living room or your backyard or wherever you feel comfortable.
Right. And they can also take a look around your house and suggest ways to make it safer and easier to get around. Maybe you need some grab bars, maybe some ramps, or even just rearranging furniture to make things easier.
So they're not just thinking about your physical abilities, they're thinking about your whole environment. It's very holistic.
Exactly. And they can also help you with things like assistive devices, walkers, canes, that sort of thing. They can make sure you're using them correctly and that they're the right fit for you.
It really sounds like they become a partner in your recovery, helping you navigate all the different aspects of getting back to your best self.
That's a great way to put it. And it's not just about fixing what's wrong. It's about empowering you to take control of your health and well-being.
I love that. So if you're listening to this and you're dealing with the effects of deconditioning, whether it's from an injury or an illness or just from not being as active as you used to be, remember, you're not alone in this, and there's help available. Don't be afraid to reach out to your healthcare provider and see what kind of support is out there, especially those amazing home health physical therapists.
It can really make a world of difference.
They can. So take that first step. Reach out, get the support you need, and start your journey back to feeling your best. It's worth it.